channel Bone Education.
Hello and welcome to our channel Bone Education. As parents, we all want our children to grow up healthy and strong. But what if your child complains about bone pain, has frequent fractures, or walks differently? Today, we'll discuss common bone diseases in children and how you can spot the early signs. One of the most common bone diseases is rickets. This condition is most often caused by a vitamin D deficiency, which plays a key role in bone health. Children with rickets may develop bowed legs, soft bones, delayed growth, excessive sweating during sleep, irritability, and may startle easily. It is more frequently seen in children with limited sun exposure or poor nutrition. Premature babies and infants born during the autumn and winter months are at higher risk. Osteogenesis imperfecta is a rare genetic disorder associated with collagen mutations, also known as brittle bone disease. In addition to bones being prone to frequent fractures, other signs include bluish tint to the whites of the eyes and shorter than average height. Symptoms can range from mild to severe with significant bone deformities and very frequent fractures depending on the type of the disease. In many cases, symptoms appear early in childhood. Another rare genetic disorder is hypophosphatasia. It is characterized by impaired formation of bones and teeth, affecting mineralization, the process of depositing calcium and phosphorus into the bones. This is due to a deficiency of an enzyme called alkaline phosphatase. It causes skeletal changes similar to those seen in rickets. In children, symptoms may include short limbs, delayed walking, frequent fractures, soft skull bones, breathing difficulties, kidney complications, and premature loss of baby teeth. Symptoms can range from mild to severe and in some cases may appear even before birth. Diagnosis usually involves blood tests, genetic testing, and sometimes X-rays. Another rare bone condition is fibrous dysplasia. This is a genetic but non-inherited disorder in which normal bone tissue is replaced by fibrous tissue, making the affected bone weak and deformed. Children may experience bone pain, which is a very common complaint, as well as swelling, fractures, or uneven growth, most often in the legs, arms, or face. It can affect one or multiple bones, and in some cases, it is associated with hormonal problems or skin pigmentation changes appearing as part of more complex syndromes. Diagnosis involves X-rays, CT scan, MRI, and sometimes biopsy. Juvenile Idiopathic Arthritis is a chronic autoimmune disease characterized by joint inflammation in children. Common symptoms include morning stiffness, swelling and inflammation of the joints, pain, and limited mobility. It can sometimes begin with high fever and a rash, and the symptoms, as well as the number of affected joints, vary depending on the type of the juvenile arthritis. When symptoms are mild, it is often mistaken for normal growing pains, which can delay diagnosis. However, early diagnosis is crucial to prevent long-term disability. Bone infections, also called osteomyelitis are another condition that can affect children and require immediate medical attention. These infections are usually caused by bacteria entering the bone. Symptoms often include fever, swelling, redness over the affected area, and a reluctance to walk or use a limb. And finally, while bone tumors in children are rare, they are important to recognize early. Tumors can be either benign or malignant, but both types can cause issues. Warning signs include persistent bone pain, especially at night, swelling, or unexplained fractures. Diagnosis usually requires imaging and, in some cases, biopsy to determine the exact cause. Although many of these conditions are uncommon, early detection and treatment are essential. If you are ever worried about your child's bone health, don't wait, consult a healthcare provider right away. But when should parents worry? While some aches and pains are just a normal part of growing up, there are certain signs that shouldn't be ignored. You should see a doctor if your child has persistent or severe bone or joint pain, swelling or warmth over a bone or joint, unexplained fractures, limping or trouble walking, delayed growth or visible bone deformities like both legs, or if it has a fever along with bone pain. Early diagnosis is key. Your pediatrician might order X-ray, run some blood tests, or refer you to a bone specialist for a closer look. Don't forget to promote bone health to keep your child's bones strong and healthy. Make sure your child gets enough calcium and vitamin D. Encourage outdoor play and regular physical activity. And don't skip those checkups. Early screening can catch problems before they become serious. Thanks for watching Bone Education. Understanding bone conditions in children empowers you to act early and protect your child's growth. Be sure to subscribe for more expert videos on bone health. See you soon.